How do I adjust NIPPV settings? If you are wondering how to adjust non-invasive positive pressure ventilation settings, you are in the right place. This technology is essential for managing sleep apnea and other breathing issues. Let's break down the steps to ensure you get the most effective treatment. First, understand that non-invasive positive pressure ventilation delivers pressurized air through a mask. This helps keep your airways open and supports your breathing. The two main pressure settings to focus on are inspiratory positive airway pressure and expiratory positive airway pressure. Inspiratory positive airway pressure assists with inhalation, while expiratory positive airway pressure keeps the airway open during exhalation. To start adjusting your settings, begin with typical initial pressures. A common starting point is an inspiratory positive airway pressure of around 12 centimeters of water and an expiratory positive airway pressure of about 4 centimeters of water. Position the mask near your face without fully applying it. This allows you to feel the airflow and get comfortable with it. Gradually place the mask on your face, ensuring you can adjust to the sensation before tightening the straps for a secure fit. It's helpful to have someone with you during this adjustment period to monitor your comfort. Next, you will want to titrate the pressures. Increase the inspiratory positive airway pressure gradually to improve ventilation and reduce carbon dioxide retention, especially during sleep. Adjust the expiratory positive airway pressure to prevent airway collapse and reduce obstructive events. You may also need to set a backup respiratory rate and inspiratory time to ensure you receive enough breaths per minute and adequate inspiration duration. Monitoring your settings is key. You can use polysomnography, which is a sleep study, or nocturnal oximetry to assess how well your settings are working. Pay attention to your sleep stages and body positions, especially during rapid eye-movement sleep, as this is when hypoventilation can be most severe. Look out for any asynchrony between you and the device, as this can disrupt your sleep and reduce the effectiveness of non-invasive positive pressure ventilation. Make sure to check for any mask leaks, particularly around the mouth, as these can cause discomfort and lessen the treatment's effectiveness. If necessary, adjust the mask type or fit to maximize comfort and minimize leaks. In some cases, arterial blood gases can help evaluate how well you are ventilating and guide any pressure adjustments. If needed, supplemental oxygen can be added to maintain adequate oxygen levels. Remember, your settings should be personalized based on your comfort and response to the treatment. For obstructive sleep apnea, the expiratory positive airway pressure is crucial for keeping the airway open. The inspiratory positive airway pressure is especially beneficial for conditions like obesity hypoventilation syndrome. Regular follow-ups and adjustments are essential to ensure the treatment remains effective, as your condition may change over time. Adjusting non-invasive positive pressure ventilation settings is a careful process that balances pressures and timing to meet your respiratory needs. Start with standard pressures, monitor your ventilation and sleep quality, and make changes based on clinical and physiological data to ensure effective treatment for sleep apnea and related conditions.